today. She's come from the Washington, D.C. area to speak with us this morning. So we're delighted to have Ruth Perot with us. I have a whole sheet of stuff here, but I'm only going to tell you a few and let her tell you the rest. Ms. Perot is a co-founder, executive director, and chief executive officer of Summit Health Institute for Research and Education, better known as SHIRE. SHIRE serves as a resource for the achievement of health parity and optimal health for all Americans, with emphasis on communities of color. Since 1998, Ms. Perot has guided SHIRE products for the California Endowment, the Commonwealth Fund, Consumer Health Foundation, Office of Minority Health at DHHS, and a bunch of others. She has served as an expert consultant, and here again we have a very long list. An advisor to Health and Human Services for the Healthy People 2000 report on African Americans, the Office of Minority Health, not a long list. She's the principal author of numerous reports, including an acclaimed study on federal data-related activities, the results of which were published in September 2001 by the Commonwealth Fund, entitled Racial, Ethnic, and Primary Language Data Collection in the Healthcare System, an assessment of federal policies and practices. She's a Phi Beta Kappa graduate of Oberlin College and received an MA in teaching from Harvard. Please let us all welcome Ms. Perot.
Good afternoon, everyone. I was hoping that we would be able to read that short version. We live a long time, you know, it gets longer and longer and longer. But thank you so much for the kind introduction. I want to acknowledge, first and foremost, how pleased I am to be here and see beautiful. But I also want to thank Lisa. Lisa has been extremely patient and persistent, working with me since over 8 months, I think. Trying to get me here. And we were poised to do that last November, and in fact the day before I was scheduled to take my flight, for reasons that are still completely unknown to me, I fell on my way to my office and hit my chin and had 18 stitches. And so my husband, who will probably be joining us at one point, said, "Dear, you might think about not going to New Orleans because you can't talk. And besides, I think your jaw hurts." And of course, at that time I said, "Oh, I can handle it." Well, when the anesthesia wore off, I realized he was right, and so we had to reschedule. So I'm glad to be here today. Now, if you hear a little fogginess in my throat, it's because I was diagnosed with bronchitis last week, but I said, you know, this time wild horses will not keep me away from this one. So, I just want to let you know that I wanted to be here, and I'm glad to be here. Interestingly enough, I know about Tulane. Our first cousin, Dr. Rebecca Shearson, in the School of Social Work, is a professor here. Some of you may know. So I know about Tulane, but I also know because we have gotten 2 wonderful interns from Tulane to work at SHIRE over the last several years in the summer. And so they brought great expertise, excitement, enthusiasm, and we were glad to have them. So just want to let you know, Tulane has a soft spot in my heart. All these great interns, keep on coming. And then finally, of course, New Orleans is a very special place for me as well. And I admire and have always admired the courage and commitment to community that is here in the residents that can live here. So if I could, I would probably live here, but not like the very short. Now, I'd like to bring you greetings from Washington, D.C., from SHIRE, Summit Health Institute, and from the Healthy Kids, Healthy Communities D.C. Partnership. I'd like to say I bring you greetings from First Lady Michelle Obama. Can't say I'm authorized to do that, but you know her commitment to Let's Move, and everything we're talking about here is consistent with the goals and objectives of Let's Move. So I'm sure she and the thousands of people who are working with her are with us in spirit and telling us to keep on keeping on. Now, I'm going to get to the slides in a minute, just let you know, I haven't forgotten. But I want to provide a little context because I'm not a person who likes to talk about problems. Even though I know we have them, that's why we get motivated to do something about them. But you know, we do have a problem here with obesity. We have a serious problem. It is an epidemic, and we tend to overuse the word, but this time is real. We have a serious problem, and I'll just kind of give you a few examples of why it's so serious. Recent data indicate that an estimated 34% of adults are obese as opposed to just overweight. And more than 2/3 are either overweight or obese. Now, you look around the room and say, well, it's us, and that's fine. But the fact is there are many, many people who are dealing with this situation. Now, more than 1 in 6 children in the United States is obese, not just obese. What is obesity? It means a BMI at or above the 95th percentile of the sex-specific BMI per age. So that's a serious. Now, furthermore, there are racial ethnic differences that are significant. According to some data that we reviewed recently, African Americans have a prevalence of 51% higher rates of obesity, and Latino Americans 21% higher obesity rates as well. So when you look at the data for a particular community, if you don't know how that's broken down, you really don't have a fix on how severe the problem is. Let me give you an example from Washington, D.C. I'm going to give you the story of 2 wards. Ward 3 is the inward D.C. It's the one of the more affluent wards. It's not populated by minorities for the most part. And in Ward 3, the percentage of children ages 6 to 12 who are overweight is 10.8%. Now, contrast that with Ward 8, which is where we work, where the statistics about obesity and chronic disease are the most severe. The percentage of children who are overweight, again, the same age, is 44.2%. So we're contrasting 10.8 on the one hand, to 44.2% on the other. So when we talk about obesity and overweight, clearly we have to think about the communities that experience the issue and can benefit most from our efforts. And that's why we at SHIRE and we with the partnership decided to target those parts of D.C. that are most affected. Let me just, one other piece. Why does that matter? Why is it important that why are we caring about obesity statistics? Can you all tell me how many health conditions you think might be related to obesity? Any suggestions?
A lot.
A lot. Easy answer, not quite complete. Give me some examples. What particular disease is impacted by obesity?
Heart disease.
Heart disease, absolutely.
Diabetes.
Absolutely.
Stroke.
Stroke, yes. Hypertension, yes. What else?
Cancer.
Yes. And we can add osteoporosis, asthma, etc. This is a biggie. It's so big that according to the CDC, Centers for Disease Control and Prevention, if we really calculated the obesity-related medical costs in the United States on an annual basis, anyone guess how much that would be?
Billions.
Billions is right. 147. Now, you know, that could take a huge bite out of the deficit. $147 billion per year associated with obesity-related disease. So this is a biggie. We've got to deal with this, and the question is how. I said I don't like to talk about problems. I like to talk about solutions, and I'd like to share a little bit about the 2 organizations that I was associated with in the introduction. One is SHIRE, and you heard that we were founded some years ago, actually founded out of the first health reform campaign from the Clinton administration. We're trying to really make certain that the concerns of African Americans and other communities of color were addressed. That's how we got started. And we became a policy research advocacy organization, networking organizations, community outreach organizations are always mindful that whatever we did on the national level had to be grounded in community experience. So SHIRE has done a variety of things over the years. In the year 2005, late 2005, and we've always been had a national focus, but of course we're in the Washington D.C. area, we're located in Washington D.C. In late 2005, we got an opportunity through Kaiser program to apply for a grant under their HEAL program. HEAL standing for Healthy Eating, Active Living. The HEAL program offered a chance to do anything innovative about tackling this obesity epidemic that I just described. We said, now we're talking a lot about childhood obesity and what we've got serious problems with adult obesity. But what if we approach the issue from the standpoint of preventing young children, very young children, from being obese? And I'm talking about ages 0 to 5. What if we zero in on that group? And what would be the advantage of that? Well, first of all, we could keep youngsters from moving down the path toward overweight obesity. Secondly, we said, we can engage parents. But many adults don't want to talk about obesity. It's a sensitive topic. It's a sensitive subject. But if we talk about obesity with young children and their children, we think they might be willing to be engaged. And thirdly, remember the way youngsters used to say, Mommy, put out your cigarette because it's not good for you. Or, would you put on your seatbelt, Daddy, because you know you're supposed to wear it? Children can be very powerful advocates for goodness. If they get excited, if they get engaged, and if they get involved, and especially young children. So we said, why don't we try to build awareness among young children about healthy eating and active living, and let that spread into the community. So for all those reasons, and also because nobody else was doing it, we came in with a proposal to focus on early childhood obesity prevention. And out of that grant, we created something, I'm getting there. We created something called the Early Childhood Obesity Prevention Collaborative. Now, this was an opportunity to bring to the table a whole range of people who are concerned about children, concerned about obesity, and concerned about the fact that we need to do something about it. So we asked government agencies to come at the DC level and federal level. We asked academia, the two names of the world, at least DC version, to come. We asked ministers to come, media to come, and most importantly, we asked our nonprofit colleagues in the field to come. Anyone who's dealing with any of those issues have relevance. And then we said, but we must be sure that the community is at the table. And so we made certain that folks from the community we were targeting, we're looking at most closely, which we'll talk about in a minute, were at the table. Now, we had two rules for everyone who came to the table, and that was, please leave your egos outside. And two, please step out of your silos. Anybody know what silos are? You know, this is my area. This is my area. This is my area. Do not come with that mentality because it won't work here. We're going to talk about the problem across disciplines, across agencies. We found out there were people in the same agency who didn't know that we were all working on obesity. But we found it out when they came to the table. I can tell you that collaborative was started off in 2006 with 30 people, now has 140 people. And they represent themselves and organizations. And it has become a safe place to talk about what we're all doing together. It also has become a great think tank. And out of this coming together and generating ideas and not worrying about whose idea it was, we got ideas for both programs and policies. SHIRE's role in all of this was to keep the collaborative going. We meet every 2 months. And to take those ideas and see if we could find some funding to support it. One of the set of ideas that came out of that was to engage, identify, and train peer educators, both adults and teens. And we got funders for that. We got the Department of Employment Services to give youngsters stipends so they could be paid to learn, and we made sure that they became community advocates. That was their part of the training. And the adults similarly are doing the same. Another idea that came out of that is spread the word about this issue. Build the buzz, and you will see the materials there. All of those really came out of the suggestion that we needed to make certain that obesity prevention became something that was widely discussed and talked about in the community, broadly and at the community neighborhood level. And so that's why we generated all these colorful things to get people to put on their buttons, put on the buttons, put the magnets on the refrigerators, and keep it alive, keep the issue alive. If you want to build a movement, which is what we ultimately were trying to do, and are trying